now we come to our session. So the meeting is organized in two different sessions. The one before the lunch break, session 1, is related to liver cancer prevention and health promotion. And after the lunch break, we have session 2, mainly dedicated to early detection and liver cancer screening. There are a few housekeepings I would like to share with you in the next slide. So please ask your question with a Q&A function, and we will keep your question and we will then discuss it after each of these sessions where we have a Q&A part. Please be aware that this meeting will be recorded, also for the purpose that it can be viewed on demand. And we would be very grateful if you give us your feedback, whether you enjoyed this meeting and what is your feedback to this overall event and to the speakers. So thanks a lot for that. And then I would like to give you a brief overview on the first session. And I will first give the floor here to Maria Bucci, who will present EASL's efforts to make the voice of the entire liver community heard by the European institution with an open letter on the treatment and prevention of liver cancer. And we have then 4 honorable EASL experts, and they will then highlight the burden of liver cancer in Europe and the possible holistic approach to cancer prevention using liver cancer as an example. Afterwards, we will discuss with key opinion leaders from the European Commission and the Committee of Regions what can be done at the EU level to change the sad landscape of liver cancer in Europe. And Marco, we have also 3 patient representatives, and perhaps you can introduce them.
Yes, thank you very much, Thomas. So we will have this part as one of the really important parts, because every patient advocacy starts with a good data. So we have patients from 3 different countries that will present what is happening in the countries, just to have a feeling of what is going on if you are a liver cancer patient or a liver patient from different parts of Europe. But in regards of the expert view or expert opinion, we should stress very clearly that any kind of patient advocacy starts in hand with a clear data from medical experts. So we are looking forward to this first part, and on second part we will go step by step to present what people that are faced with liver diseases are experiencing in different parts of Europe.
Thank you, Marco. So now I will give the floor to Professor Maria Bucci. Maria Bucci is EASL's policy counselor and chief of internal medicine and hepatology at the Hospital General University Vall d'Hebron in Barcelona, Spain. So please, Maria, present the EASL open letter.
Good morning, everyone. It is my honor to present today EASL open letter 10 asks to improve liver cancer care and prevention in Europe. EASL recently launched advocacy activities for a better inclusion of liver cancer in European health policies. This letter is addressed to the President of the European Commission, Ursula von der Leyen, the members of the European Parliament, and the President of the European Council, Charles Michel. The letter includes 10 asks for improved liver cancer care and prevention in Europe. We are very proud of this initiative and strongly hope that this ask will be heard by the European policy makers. Liver cancer is on the rise, whereas other cancer incidence rates are declining. In fact, there has been a 70% increase in liver cancer-related mortality. Liver cancer is the 6th most common cancer and the third most frequent cancer-related mortality in recent years, making it the 6th most frequent cause of cancer-related death globally. Liver cancer occurs mainly in patients with liver cirrhosis. And liver cirrhosis, and particularly liver cancer, are usually diagnosed late when the life expectancy is short. The most common risk factors related to liver cancer, chronic viral hepatitis, obesity, and fatty liver disease, and alcohol consumption are factors that we can treat or even we can prevent. Here, the importance of this open letter. Now, I will quickly go throughout the main message of this 10 ask. First, raise awareness, prevention and management standards. Second, improve access to better disease management for all patients. Third, enhance cooperation among hepatologists, oncologists, and other healthcare providers. Encourage collaborative clinical management guidelines, and also reduce existing inequalities and ensure the highest standard of care for our patients. Very important, introduce liver cancer screening to national schemes and implement preventive measures to reduce our risk factors. I have mentioned that we can modify these risk factors. Set up specific patient registries to collect data and share data to close the gap between medical knowledge and practice. And then mobilize all interested parties to get actively involved in these 9 asks. The European environment allows us to be active and influence health policies and to push for implementing measures for liver health. There is a strong political commitment for cancer, and the amendment 623 on liver cancer screening of the Becker report is under consideration. EASL, with a large community engagement, is encouraging to keep liver cancer screening in the plan. And to show that this is really important, we have a large community engagement. As you can see here, the main associations, patients associations such Liver Patients International, ELPA, medical organizations, AA, SLD, other organizations, and also a large number of individuals have signed or endorsed these 10 asks. Help us fight liver cancer in Europe. I think this is really important. So I will ask all of you to support these 10 asks. Thank you very much for your attention.